Hello, Medicare Bob here with Senior Healthcare Direct, and it is Rate Watch Wednesday. What is Rate Watch Wednesday? Rate Watch Wednesday is when I take you behind the scenes and show you how we pull our Medicare supplement quotes. We pick one zip code and one market, and we show you all the top rated carriers and what their price is for Medicare supplement insurance. Today, we're going to visit Ohio. So we're going to go to 43081. We're going to take a look at a 65-year-old female. We're going to do non-tobacco. If you're a tobacco user, it normally is going to add about $5 to $10 per month on your Medicare supplement premium. We're going to take a look at Medicare Supplement Plan G quotes. I'm going to pause right here and just talk about Plan G. Plan G is my favorite plan. It's been my favorite plan the last 10 years. It's my favorite plan looking forward. The reason I like the Medicare Supplement Plan G is it's the only plan that will still guarantee your health care cost, because Plan G is so comprehensive that it's going to pay your Part A deductible, your Part A coinsurance. It pays the Part B coinsurance, which is the 20% that Medicare doesn't pay. With the Plan G for Medicare approved services, all you have to pay is the Medicare Part B annual deductible, which is a very small deductible. Right now it's a couple $100 roughly. After you pay that, Medicare is going to step in and pay 80%, and then your Supplement Plan G pays the remaining 20%. So with Plan G, if you go to the doctor, provider, get a procedure done, after you pay that deductible, Medicare is going to pay 80%, and the Supplement G pays 20%. Plan G also pays your hospital bills for Medicare covered services. So it's going to pay that Part A deductible and the co-pays that start starting day 61. So I'm a big fan of Plan G because, as long as you pay your monthly premium, you're not going to have any co-pays or out-of-pocket surprises. Also with Plan G, you can go to any doctor, any hospital nationwide that accepts Medicare. It's really important when you have a Medicare supplement plan that you ask the right question to your providers. If you call your provider and ask them the carrier that you have and say, do you accept this carrier? They're going to look at their HMO or PPO listing, which can be confusing. The right question to ask is, do you accept Medicare? If you have a Medicare supplement plan, you can go to any doctor, any hospital, any provider in the whole country that accepts Medicare. The way that the quotes are going to be sorted here is it's going to be the lowest monthly premium, and as I scroll down, you'll see the prices get higher. Now, that's right. The prices are going to be different for the same exact plan. So even though the doctors take it the same, and even though the benefits pay the same, there's a lot of really good carriers that offer the Medicare supplement plans, but they all charge different prices for different reasons. All right, we're doing effective dates. And then last thing I'll do here, discuss with you before we go into the quotes, is talking about a household discount. Most companies offer a household discount nowadays. Some don't. So the household discounts can range from 0 all the way up to 14%. A lot of carriers are offering these household discounts now, really 7 to that 14%. And that's a great way to save a lot of money. The quotes I'm going to show you here are not going to include any household discount. But whenever you go to our website or give us a call, just our agents will ask you the household discount question. So make sure you answer that correctly, because it's an easy way for you to save some additional money. Let's take a look at the quotes. Okay, so this is our quote report. All of our licensed agents here at Senior Healthcare Direct, powered by your Medicare Bob's office, all of our agents have access to these quotes. We pull these quotes for you whenever you join with as a customer or as a client with our agency. But we don't just pull it now. We're going to help you look at your quote every single year. So Medicare supplement premiums do increase, or at least have an adjustment every year. And so we'll be able to help you shop this every year. So our clients never overpay for their supplement plan, because they always shop with us when they get an increase. And if they're eligible, we get them the price that they're best eligible for. So let's take a look at a 65-year-old female here in Franklin County in Ohio. Okay. The most cost-effective Plan G right now for this person would be Aetna, which is Continental Life, at $103.54 per month. The next best price is Mutual of Omaha at $104.07. Heartland National's $106.06. Manhattan Life's $106.83. Capital Life's $108.68. United Healthcare, which is endorsed by AARP, is about $115 per month at $114.66. Ascendo, which is Aetna and CVS's joint Medicare supplement company, that's $117.04. Now, they're one of the companies that have that 14% household discount. So if you were applying with somebody, then Ascendo would be very competitive in this scenario. Humana's $121.64. Medico's $135. So just to bring this point home, if you were to call one of these carriers, say you saw a Humana commercial and you called them and discussed Medicare supplement insurance and you agree that Plan G is the way you want to go, so why work with an agent instead of calling the carrier directly? Here's the proof. If you call them, Humana's a great company, and in some areas, they might be the most cost effective at some age groups or brackets or some zip codes. But here in this area of Ohio, Humana's charging $121.64 for a non-tobacco 65-year-old female, when you could get the same exact plan. Doctor takes it the same, hospitals take it the same, and it pays out exactly the same. And you could get that same plan for $103.54. So that's really the value prop of working with an agency like us, is we're going to help you get the most cost-effective price for the plan that you want. Let's take a look at a 65-year-old male's price just to show you the variance. Aetna is also the lowest premium right now at $119.04. Mutual of Omaha's $119.67. Another reason to work with a broker? Look here. Aetna is charging a $20 policy or application fee. Mutual of Omaha is not charging that. So even though Mutual of Omaha is about 60 cents more per month, it's actually going to be either about the same price or less money because it doesn't have an application fee. Scrolling down here, Anthem's $120.83, Heartland's $121.97, Great Southern's $129.35, United Healthcare, endorsed by AARP, is $129.60. And as I scroll down, the prices increase. But just illustrating here again, United Healthcare, great company. They have a great direct mail campaign. You probably got something in the mail if you're turning 65 from them. You might be an AARP member and you like them, and United Healthcare is a great company. And there's nothing wrong. There's no bad choice here. If you called them and signed up for Plan G at $129.60, you're going to be very happy. It's a great plan. That's not a bad price. But working with Senior Healthcare Direct, we would get you that plan for a little bit less money. Okay? And again, it's almost, to me, sure, in that scenario, it's just a few dollars. But to me, it's the principle of it, right? Like, why would I pay more for the exact same thing when I can get it for less? So that's part of it for me. All right, we're going to look at two more quotes here in Ohio. We're going to look at a 70-year-old female. Okay? Now, look, we have a new top contender, Heartland National at $108.54. Then Aetna at $109.87. Mutual of Omaha, $112.18. As I scroll down, Manhattan Life, $113.17. Humana, $125.84. United Healthcare, $126.13. And as I scroll down, Medico, $140.31. Like these prices, Cigna. Cigna's a great company, okay? But $156.67. So why pay more money for the same exact plan that you could get from Heartland, for $20 to $30 less per month? All right, last quote we're going to look at here for today is for a 70-year-old male. So 70 male, non-tobacco, Plan G. Heartland's the most cost-effective option at $124.82. Aetna's $126.37. Mutual of Omaha's $129.01. Again, the prices just increase. Let's see, Pan America's $140.50. Pan American's like healthcare.com. Okay, again, if you go to healthcare.com, call them and you enroll with them, it's $140 opposed to getting the best price. United Healthcare, AARP, is $142.55. Ascendo, which, remember, that's that CVS Aetna joint company, that's $142.78. Humana, great company, very competitive with Medicare Advantage and Part D. But in this particular area, for this age group, not that competitive at $144.73. These are all great companies, and you'd be surprised. In one area of Ohio, so-and-so carrier could have the most cost-effective premium for the Plan G. Another area, another company could. It depends if you have a household discount or not. If you're a tobacco user, these companies have height and weight adjustments. Some are different. It's really important to work with an agency like us. So that's the value prop. So let us do the work for you. We have access to this stuff. We're pros. We're all AHIP certified. Here at Senior Healthcare Direct, Medicare Bob's office, powered by your Medicare, we're going to help you with really three main value proposition. Okay, we're going to give you free education. Okay, so we're going to teach you what is Medicare, what does it cover, how much does it cost, when does it start, and then really what are my coverage options, right? So then we're going to go to options. Okay, that kind of goes into play with your coverage options or coverage opportunities. So you have Medicare Advantage, Medicare Supplement. All of our agents offer both. We're not biased on which one you should go with. We're going to give you the pros and cons on both, right? If you choose Medicare Advantage, we have a list of A-rated carriers that we're going to help you kind of filter through. If you choose a Medicare Supplement Plan, as you can see, we're going to get your height, your weight, your health profile in order to help you on the quote, if there's any adjustments, okay, because you have to medically qualify for a supplement unless you're brand new to Medicare. We're going to get your tobacco use. We're going to see if you qualify for any discounts. We're going to give you an exact quote. And then that last part of that is customer service as the third option, or the third reason to work with us. Not only are we going to help you right now when you first sign up, but we're going to help you every year. Every year, we're going to help you make sure you always have the lowest premium for the plan that you want, and that's right for you. So let us do the work for you. Go to the website that's listed in the description, or give the phone number a call that's listed on the video and also down in the description as well.